My name is Madupe Ogiyami, and today I will be presenting on young children and sign language.
So my name's Esther, I'm a speech language therapist. I trained in England and came to New Zealand 6 years ago. I work mainly with children preschool age and also some children with complex needs in schools. Communication is something we do every day, whether we do it non-verbally or verbally. We communicate with lots of different people at all different times. It's something that we do naturally, whether it's verbal or non-verbal, and it's just a very social way of being with people and enjoying each other's company. It also means that when you can communicate, you can tell people either what you want, what you don't want, which is really important, and also give your opinion on things and comment about what you like or don't like.
Hi, my name is Dina and I'm a clinical nurse specialist lead for intellectual disabilities at Palmerston North Hospital. I've been an intellectual disability nurse for 30 years and my whole passion inside and outside of work is enhancing the quality of care for people with an intellectual disability, and if they can't communicate their need, then they can't self-empower themselves. 40% of all people with an intellectual disability have communication needs, and we know that people with an intellectual disability also have a higher health need than people with the general population. So it's really important that we assist them to communicate more effectively, because quite often when people can't communicate their needs effectively, then they're seen by the health profession as challenging behaviour. So therefore then there's barriers put up and their health needs aren't met. So if we can assist people of any age to communicate more effectively, be it through visual communication, sign language, picture boards, whatever, then we enhance them to communicate more effectively and get their health needs met.
Hi, my name's Ali Atwell, and I run a non-profit organisation called Voice Through Your Hands, and we're about promoting the importance of visual communication and New Zealand Sign Language for the hearing community that have difficulty with speech. Able to communicate, it really makes you have confidence about who you are and be able to interact with people. Even if they can't always understand what you're saying, you know that you're getting your message across, and that's the best thing. It just, the whole world becomes open to you, and you have just got so much more passion and much more life in you when you know that you can express your feelings and your concerns and things that really are exciting to you.
From a health perspective, if you have an adult lying in a bed and they're 6'4" and 200 kgs, but they have a moderate to severe intellectual disability, then developmentally you're looking at someone who is going through the stages of 5 to 6 year old. But from an outside, they're looking at someone who's 46, 47. But if communication is difficult for them, then their only way of expressing pain is to scream and shout and wave their arms and legs. And that would be perceived by staff as aggression or violence or threatening. But if you can teach them a few signs of pain, hunger, thirst, then suddenly they're not seen as the aggressive patient in room C4, but they're seen as the person who's frightened, hungry or in pain.
I know with my daughter, Taryn, when she was little, she had no communication at all. She wasn't able to talk. And I know that when she was around, she didn't have access to communication. She was very quiet and very reserved, sat back and watched a lot and didn't participate in a lot of what was going on at school. And as soon as we opened her world to using New Zealand Sign Language, and then actually got everybody else around her using New Zealand Sign Language as well, this little girl just blossomed, and she now has no worries about communicating with anybody, and she doesn't have a communication difficulty. Other people might have difficulty understanding her, but she has no communication difficulty anymore. And that's what we want for all children, to have that confidence to be able to communicate throughout in the world.
So for some children, we'll try different approaches to see which one works best for them. And it may be that we use a combination of those things in different situations. So if children are very visual and look at photographs and enjoy books and things like that, then we'd look at using some pictures to help them understand about different things. They may then use some sign alongside the pictures, so we can use a combination of ones. And also in different environments. If your child is in an environment where sign isn't being used, then for them to be able to use pictures in a different environment is going to be really beneficial for them, because there's nothing more frustrating than trying to talk to somebody and them not understanding you. So children can use whichever forms help them in whichever situations.
Some of the fears that people have around using New Zealand Sign Language. For example, one of the biggest ones that people are really worried about, that if you're going to use New Zealand Sign Language, then our children aren't going to be able to communicate and or not use their words, because it's going to be so much easier to sign, so then they're not going to talk. Actually, the reverse is true. Actually encourages the speech, because what it does is it encourages the communication. And when somebody is communicating with you, you communicate more, so you're talking more to them, and that whole signing, and you've got an understanding of what they're trying to say and helping them to articulate the words. So then by the end of it, they are actually being able to talk and say the same things and read a book, so other people can understand.
In the process of creating this project, I asked people questions regarding sign language. And the first question I asked was, what is sign language? Majority of the responses were, a way to communicate with your hands, a number of preset known symbols utilized with your hands, another form of language or communication, interpretation, communication utilized for individuals that can hear but cannot talk, and a communication outlet that is utilized by individuals that are deaf or hard of hearing. The second question I asked was, who uses sign language? The responses were individuals that are deaf, individuals who are hearing impaired, people that cannot speak, babies, animals, and everyone. Then the last question I asked was, who benefits from using sign language? And the majority responded, the deaf community, the hearing impaired, and individuals who cannot speak. So now I'm going to give you all some history on what literature says about sign language. But just so you all know, for the purposes of this project, sign language and symbolic gesturing will be used interchangeably. First, we will start with sign language and children who are deaf or hard of hearing. The common sign language utilized by these children is American Sign Language, which according to the National Institute of Deafness and Other Communication Disorders 2017, is a language that employs signs by utilizing hand gestures combined with facial expressions and body posture. American Sign Language is primarily used by North Americans who are deaf and some individuals who are hard of hearing. And in the deaf community, there has been some controversy on whether children who are deaf should utilize sign language or not. Some of the controversy includes sign language would delay speech, sign language is unnecessary due to cochlear implants, and sign language would lead to termination of the deaf community because hearing people think they are fixing people that don't want to be fixed. Schlesinger and Meadows, 1972, conducted a research study to examine the effects of spoken word plus sign English with a toddler named Ruth. After 4 months of intervention, close to Ruth's 3rd birthday, her verbal language increased while utilizing sign language and then eventually without it. After that study, some people within the deaf community acknowledged that sign language is utilized as a tool for individuals that are deaf or hard of hearing to communicate with the hearing people with no intentions of getting rid of the deaf community. The second idea found in the literature is sign language utilized by children with expressive deficits. Codner, Beichelman, Doncho, McCarcher, Tate, and Thompson 2007, along with Fletcher, Howlett, Kirk, and Pine 2013, agree that children with weak or impaired verbal abilities can benefit from symbolic gesturing. Some of those disorders that have expressive deficits include Down syndrome, autism spectrum disorder, specific language impairment, and Landon-Klofner syndrome. The last idea found in the literature is the use of sign language in normal hearing infants, which brings us to the reason you and I are here today. There has been some theories surrounding the benefit of normal hearing children utilizing sign language that generates questions that parents and professionals would love the answers to. These questions are, does sign language delay verbal development? And does sign language influence infants' language development? So today, we will be exploring the language development of typical developing children, research studies regarding normal hearing children and symbolic gesturing, and how parents influence their child's language development. So, let's get started. Accordello, Brown, and Godwin 2000, Hawaya and Spandeas 2014, Golden, Meadow, and Iverson 2005, and Gross, Lewis, and Wu 2014 agree that the first gesturing milestone is didactic gesturing, which occurs between 8 to 10 months of age. Didactic gesturing is a form of nonverbal communication where babies use intentional gestures such as pointing, reaching for objects, holding up objects, or giving objects to communicate to their caregiver what they want. Also during this age range, Hawaya and Spandeas 2014 stated that children should be able to comprehend words. Some basic words include their name, objects such as ball or cup, differentiating mom and dad, or acknowledging that mom and dad are the child's parents, and simple commands such as stop and come here. Infants will demonstrate comprehension of these words by acting, looking, pointing, or giving what was asked of them. Accordello et al. 2000 states that an advanced gesturing milestone is referred to as pantomime. Pantomime is a milestone where children start to utilize their body parts to represent objects, which transitions into recognizing that the object does not need to be present for them to pretend that it is, such as using a finger to write notes as if a pencil was there, or using your hand as if it was a telephone. Accordello, Brown, and Godwin 2000, Fletcher et al. 2013, and Hawaya and Spandeas 2014 agreed that symbolic gestures occur between 10 and 24 months. They also share a similar definition of what symbolic gestures are, which is a form of hand movements that represent the function of the item. Some of these uses of symbolic gestures are communicative in function, like didactic gestures. But unlike didactic gestures, it carries meaning in its symbolic form. For example, if a child points to food to indicate that they want more food, that would be a didactic gesture. But actually utilizing a hand movement that indicates more is a symbolic gesture. It resembles objects and concepts like pantomime. It's actually used to substitute for speech, unlike pantomime. And it may or may not use a body part representation. For example, pantomime might use a fist to represent a ball, while symbolic gestures would utilize the throwing motion to indicate a ball. Now that you have been informed about the language development of a typical child, we will discuss research studies that have been conducted to answer the questions: does sign language delay verbal development? And does sign language influence infants' language development? Accordello et al. 2000, Fletcher et al. 2000, and Gold, Meadow, and Iverson have all conducted a study to answer these questions. Accordello et al. 2000 conducted a study with 58 boys and 45 girls that began the research at 11 weeks old and ended at 36 months. They were divided into 3 training groups with their parents, which were the sign training group, the non-intervention control group, and the verbal training group. The verbal training parents taught their children preset words provided by the researchers, while the sign training group taught their children to sign the preset words. The non-intervention group were not given any instructions on what to do. The children were assessed with language assessments at 11, 15, 19, 24, 30, and 36 months. The results revealed that children in the sign training group scored higher on receptive tests, expressive tests, and had longer mean length utterances than children in the non-intervention control group and the verbal training group. Results concluded that sign language does not delay verbal development, and sign language can accelerate infants' language development. In the Golden, Meadow, and Iverson 2005 study, it included 5 males and 5 female children that were initiated at 10 months of age and ended at 24 months. They were assessed based on the way they communicated their wants and needs to their caregiver during everyday activities within their home. Golden, Meadow, and Iris in 2005 discovered that infants who utilized functional gestures such as pointing, holding up objects, and reaching for objects to communicate started to utilize gestures plus words, then gestures plus word combinations, which transitioned over to two-word combinations without gestures earlier than children who did not utilize gestures. Golden, Meadow, and Iris in 2005 concluded that gestures both precede and is tightly related to language development. And at the lexical level, previously known gestures that were in the child's repertoire was found in their spoken vocabulary. These results concluded that sign language does not delay verbal development, and sign language can accelerate infants' language development. And lastly, in the Fletcher et al. 2013 study, there were 40 mother-infant dyads with 5 males and 5 female infants in each group. They were initiated into the study at 8 months and finished at 20 months. The children were administered language assessments at 10, 12, 16, and 20 months. Fletcher et al. 2013 concluded that overall language development of all infants was similar regardless of the intervention they experienced, and encouraging gestures did not result in significantly higher scores of any language measures. However, independently, 3 males that were in the symbolic gesturing group that started with a low baseline and expressive communication on assessments increased their expressive communication. These results concluded that sign language does not delay verbal development and that sign language does not influence infants' language development unless an expressive deficit is present. Now I would like you all to take a moment to read this quote. That makes sense, right? Even if you don't have children, but have cousins, nieces, and nephews, if you tell them to shh, don't be surprised if one day they tell you the same thing back. Same for giving them a thumbs up to say good job or clapping when you're happy. Children learn function and form by observation. Accordillo et al. 2000 stated that between the ages of 10 to 24 months, children and parents become frustrated by the slowness with which verbal language develops. According to Hawa and Spandeas 2014, studies show that increased parental stress is associated with child's delay in expressive language. Therefore, high stress equals less support of the child, which equals poor expressive communication. Gross and Wu 2014 and Schaefer and Zammer 2011 conducted research to see how mothers' responses influence their child's development, and they agreed that increased mother communication and involvement with infants equal early verbal output. Therefore, parents have an effect on their child's language development. Now, knowing all this, here are some clinical implications. Knowing and understanding your child's language development and how parents play a part will influence your clinical decision. For example, if a parent reports that a baby is crying, or the parent is frustrated, or the child is assessed and we find out that the child has a disorder or syndrome connected with expressive deficits, or the parent reveals in a case history that there is a lack of communication between the parent and the parent is distancing themselves from the child, or the parent desires communication with the child, then sign language is an option for these types of situations that can be shared with parents and taught to parents and children who are willing to take out the time to communicate with one another. After doing this project and reading many articles, I do have some suggestions for the future, such as: moms are awesome, but there's barely research about dads. Dads may have a positive effect on their child's language development as well, and if they don't, I would like to know that and why, or at least a reason for why dads aren't utilized as often in research with gestures and child development. Second, I would like to see more individualized profiles of students when communication is assessed to determine if gestures are beneficial. For example, in Fletcher et al. 2013, they concluded that sign language does not influence language development for all infants within their study. But once they dug a little further into what was revealed, the sign language did provide benefit to children that exhibited an expressive deficit within the language assessments. Last, I would like to see some research regarding gestures and different modalities. Research shows that gestures assist in verbal communication. So in cases such as Fletcher et al. 2013, when symbolic gestures did not provide any significance, would gesturing and AAC devices or gesturing and pictures be an option for the child? To sum everything up, the individuals that responded that the deaf community, the hearing impaired, and individuals who cannot speak benefit from using language were correct. In addition, I would like to add that young children that have expressive deficits, have normal hearing, and parents who are stressed due to lack of communication can also benefit from utilizing sign language. Research has shown that between the ages of 10 to 24 months, parents and infants struggle the most with communication. As a result, research has also shown that parents should interact with their child more to aid in the child's language development. And lastly, we have concluded that sign language does not delay verbal development, and sign language can increase language development. Thank you.